Hi there, it's Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. All right, today we're talking about resolving your back pain with a regenerative stem cell and exosome procedure in Mexico. Now, 25% of the patients we treat globally present because of back pain, either because they are trying to avoid surgery or they've had one or multiple surgeries and the last thing they want to do is to have another surgery. Because once that cycle starts, it often turns into a frequent flyer punch card type of program. So I did bring some visual aids. I have a little bit of a stuffed spine here, showcasing a very sad spine that's experiencing disc disease pain. He doesn't really have a back, so you can't really see the facet joints in the back that are also arthritic. And there's a little bit of a herniated disc here as well. All right, so we'll save spiny. Now, I do actually have an anatomical model here. This is the spine, low back from the front. All right, we are concerned about that, but not nearly as much as what happens back here. So what I wanted to show you is that a lot of the patients that we see that come in for back pain have pain that's being generated from arthritis in these thumbnail-sized joints called the facet joints, all right? And it's not usually just one joint. It's usually multiple, okay? Now, one of the things that a lot of patients don't realize is that about a fourth of back pain is actually coming from these joints where the sacrum meets the pelvis, the sacroiliac joints, all right? So we typically will include them depending on, a patient presentation, but you don't want to forget those, all right? Unfortunately, in the United States, a lot of pain doctors will say, oh, today I'm going to inject your right, L4-5 facet joint. One joint? That's not enough. Most patients, if you're in your 40s, 50s, 60s, are developing pain as a result of arthritis in multiple joints. So here is how we do most of our lumbar protocol procedures. We trademark the term Regenerative Trifecta. Now, what we do is we combine mesenchymal stem cells derived from umbilical cord tissue along with PRP, which is where we take a little bit of your blood, just, from your arm. We spin it to concentrate the growth factors. So it's mesenchymal stem cells, PRP, and stem cell exosomes. About 5 years ago, we started doing that combination, and the results have been absolutely fantastic for close to 90% of those who have back pain. Now, I'm not saying that we will necessarily eliminate all of your back pain, but we can resolve a lot of it. Now, here's one thing that is key to the R3 lumbar protocol. We don't just inject one joint, all right? Now, this is the key. You have to flood the low back area and often inject the SI joints with the regenerative trifecta to get the outcome that you need, okay? We're not just doing a little bit here, a little bit there. We tend to flood because even the best MDs, spine doctors, fellowship trained, board certified, what have you, get the pain generator wrong over half of the time. What that means is they'll say, oh, I'm pretty sure it's coming from this. And they'll inject this, and you'll be like, well, that helped like about 5%, if not at all, right? That's not good enough. Flooding the area and including the SI joints, if needed, is very, very helpful. Now, should you get a disc injection, meaning into the intervertebral disc? We used to do that, okay? We don't do that anymore for a couple reasons. One is very painful. It would take patients like 40 minutes to get off of the procedure table, okay? Now, they would slowly get better, and it would often help them, but the other thing is it's unclear to any of us if you put fluid into an intervertebral disc, even if it's stem cell, PRP, what have you, does it do more benefit than it does damage? long term, right? There are no studies that show that if you inject regenerative biologics into the intervertebral disc, that it's going to take it from a pancake and put air back in the tire. It just doesn't happen. So we stopped doing that years ago when more and more studies started coming out, and our experience too showed us that injecting with a flood into the low back was actually better results than doing those disc injections. All right? So not only do the vast majority of our patients get an incredible amount of pain relief, but it typically lasts a decently long period of time. I'm not saying it's going to last forever, all right? But if we can help you avoid surgery, get back to doing things that you've been missing, not have to wake up every day thinking about your back pain, wouldn't that be a great way to live, a much better quality of life? You can get back to working, get back to doing activities that you've been missing. It could be golf, it could be pickleball. You know, you fill in the blank, right? It's up to you. Now, we have multiple locations in Mexico that offer these lumbar protocol treatments: Tijuana, Cancun, and Puerto Vallarta. We offer a free consultation. Simply call us at 844-GET-STEM with a +1 for the USA, and we'll set it up for you or a loved one. We offer free ground transportation. For anyone who gets 100 million stem cells or more, we'll pay for your hotel as well. Visit us online at stemcellmexico.com and click on the YouTube channel where we have over 900 educational videos and success stories, a lot of which are for back pain who receive the lumbar protocol. Thanks for watching.